model of comprehensive MS care involves the expertise of many different healthcare professionals, each contributing in a unique way to the management of your disease and symptoms, as your disease can cause many symptoms. Sometimes this team work in a single center, a comprehensive team center like we have here, or sometimes your physician will refer you out to your community to see additional specialists. Some of the team members we're referring to here are your neurologists, particularly your multiple sclerosis specialist, your primary care provider, your mental health provider. So your psychiatrist, your psychologist, rehab specialist, your pharmacist, other specialists, maybe a urologist, maybe an endocrinologist or an ophthalmologist if you have a history of optic neuritis. Optimal management of MS is best achieved by working with a comprehensive team. You may not need all these members of your care team at any given point, but it is vital that you establish a relationship with them, know who they are, and know how they can help in the event that you do need help. For example, you do need an ophthalmologist if you're having blurry or double vision. Shared decision-making is critical between a provider and a patient. Shared decision-making is when the provider and that patient come together to make mutual arrangements. So deciding on tests, the appropriate tests to take, deciding on the appropriate treatment, and a long-term care plan. Again, you are the center of this comprehensive team gather around you. As you see, you're the center here, your family members and friends in addition. Next slide, please. Why are we treating you? What's the main goal of MS treatment? Reducing relapses and delaying progression of disability is one of the main reasons why your healthcare team wants to treat you. We want to treat your relapses. We want to manage your symptoms. So you're having some numbness and tingling, or your fatigue is becoming worse. We want to help you manage that. So that's another reason why we treat. Ultimately, we really want to preserve an adequate quality of life. So that's why we recommend treatment. Next slide, please. What are the different types of treatment we talk about? Disease-modifying therapy. A lot of you are familiar with this term. With over a dozen disease-modifying therapy now for multiple sclerosis patients, and maybe one approved for over a dozen for relapsing remitting, and one for relapsing remitting in addition to the progressive MS, CIS. There's so many options now that it's important that we have a plan. We discuss what the options are with you. Treating your exacerbation. How do we do this? We often treat your exacerbation with IV Solu-Medrol. We may treat you, seldomly we treat with oral steroids. Exacerbation. An exacerbation in MS is caused by inflammation in the central nervous system, causing damage to your myelin, slows or blocking the transmission of nerve impulses. To be a true relapse, we ask that you wait to see this happening over 24 hours. Typically, it's separated by at least 30 days. Most exacerbation lasts maybe a few days to several weeks, or sometimes months. Exacerbation can be mild or they can be severe. Can impact your function at home or sometimes even at work, causing you to go on temporary disability or sometimes even permanent disability. Managing your symptoms. In MS, damage to the myelin and the nerve fiber that I spoke of earlier, sometimes lesions in the brain and spinal cord and other parts of the body. The disruption of the nerve signal produces the symptoms of MS, which vary depending on where the damage has occurred. Symptoms can be effectively managed with a comprehensive treatment approach. Again, the symptoms, if the symptoms are with your bladder, we're gonna send you to urology. We're not gonna take it on fully. We're gonna address it, give you temporary treatment if we need to, but we will send you to urology. And again, ophthalmology if you're having some optic nerve damage. Providing emotional support. Comprehensive care include attention to emotional support as well as physical health. Mental health professionals provide support and education, as well as diagnosing and treating depression, anxiety, mood changes that are often so common in MS. Neuropsychologists assess and treat cognitive problems. We do have a lot of patients with cognitive problems. We do have a lot of patients with anxiety and depression. And it's important that you know that there are treatments out there for you. There's support out there for you. A therapist, maybe your psychologist, psychiatrist if you need treatment. Maybe you just need a little bit of a temporary dose of anxiety medication. We can help you with that, but ultimately we want you to be comfortable and happy and be mentally clear long-term. So we will refer you to a psychiatrist. Next slide, please. Making the most of your healthcare visit. How can you prepare for your visit? We ask that you keep a journal listing your symptoms and any questions that you may have. We ask that you prioritize that list. So if you have maybe 5 concerns today, let's start with your priority. You often have a 30-minute visit with your doctor. For follow-up visit, try to prioritize again. Let us know what's your main concern today so we can fully address that issue. Bring a list of your prescriptions, drugs, over-the-counter remedies, herbal, vitamins. Let us know everything you're taking. So bring it all with you. You're on your vitamin D, you're taking some B12, maybe you're doing over-the-counter remedies, you're taking turmeric. Let us know all about what you're taking. Practice describing your symptoms. So let us know you're having numbness in your legs, for example. Let us know if that numbness is radiating upwards, if it's just in that one spot. Let us know. The more we know about your symptoms, the better we are able to address and help you. Bring a supportive partner if you need to ask questions, or maybe you need to record. Maybe you'll forget something that was said in the visit. A support is really important, particularly when you're having a relapse. At that point, you may not be thinking clearly. Oh my God, what's going on? Do I have new lesions? Is this a pseudo relapse? You know, I was really stressed yesterday. I was really stressed 2 days ago because, again, you're waiting for that 24-hour mark before you really let us know. You know, you're watching it for the day, you're having numbness, you're watching it and see. And if it's continuing 24 hours, you're letting us know. So you're stressed, you're worried about what's going on. Bring someone with you if you have a support system. Next slide, please. We want you to communicate openly with us. We want you to communicate openly with us, making the most of your healthcare visit. Alert us if there's any barrier to you taking your treatment. Do not be afraid to talk to us. For example, we want you to tell us if you're maybe tired of taking your injections, or if you're experiencing some side effects, or even if you have temporary loss of your insurance. This is the real world. Sometimes we do lose our insurance, especially a patient with MS. You may have lost your job. We still have COVID around. Maybe you lost your job because of COVID. Let us know. We are here to help you. Sometimes the drug companies are okay if we speak to them to give you a temporary supply of medication. We will do whatever it takes to support you and help you to stay on treatment. Share how the treatments are working for you. We want to help. Let's discuss other medication options. If you're having injection fatigue, for example, let us know. If you're having major side effects from any of your drug, maybe you're having diarrhea on, I don't know, Tecfidera, maybe you have diarrhea on Gilenya. Let us know. We can guide you through the process. We don't want you to just stop your medication. We want to help you through the process. Share regular appointments. Schedule regular appointments, I meant to say. For example, a patient on Tysabri. We personally at this center like to check your JCV between 3 to 6 months. I know that's what maybe all clinicians do anyways. But sometimes we have patients who will go over 6 months without seeing their provider, a year, you haven't seen your provider. No, we want to know how you're doing. Particularly you're on Tysabri, for example, we want to check your JC virus. We want to make sure that you remain negative. We want to check your liver and your kidney. We want to make sure that everything is going perfect. You're on Gilenya. You're doing perfectly fine, but we want to check your lymphocytes. That's just 2 of the medication. I'm just throwing that out there. But we want to ensure that you are scheduling regular visits with your physician so you can have that communication, so you can remain healthy. We will discuss additional options with you if one medication is not working. Shared decision-making is really, really vital. We find that with shared decision-making, patients get better health outcomes. If you're involved in your care, the provider is not just dictating to you, but you're participating. You're saying, yes, I would like to do that treatment, or no, I cannot do that treatment because I don't want to do, for example, I don't want to do the once a month treatment because it's really inconvenient for me to come in with based on my job. We want you to express your goals to us. It's your treatment goal. It's not our treatment goal. It's your treatment goal. We want you to express that to us. You're not able to take a particular medication because it will impact your job. It will impact your family life in a certain way. We want you to express that to us. We will work with you and find what's the best treatment option for you. Ultimately, our goal is to see you improve. Our goal is for you to remain healthy.